how much in the mouth are you versus discussing, let's say on the first try-in,
How much in the
the
mouth?
first prototype?
Like, does it take a long time to put in
Yeah,
the teeth?
how long
or?
does it take until the teeth are there, comfortable, scanned, until you're not in their mouth any longer?
I try to be as quick and efficient as possible and try not to drag that part of the appointment. So, I
Would you
mean,
say
maybe
20 minutes, 30
not
minutes,
20
40
minutes.
minutes?
No, maybe maybe 10.
Oh, so
Yeah.
it's really only
It's
10
fairly
minutes
quick.
worth of work.
Yeah. I try not to keep them. They've already been open the day
Yeah.
before, in the surgery. So I try not to prolong that. I try to make it quick to where we're removing the cover abutments, seating the teeth, scanning them, and then taking photos.
Is that, say, 10 to 15 minutes? Is that consistent through the rest of their time? Is that about how long it is to go through that part of the procedure for each day, subsequent day as well?
I would say, yeah.
Yeah.
I mean, day 2, it's a little easier because you're just changing out the teeth and then scanning and then taking photos. So maybe it's not quite as long, and it's also dependent on the patient's comfort. If they're really sore or if they're in like a lot of pain, I haven't had any patients come in. They're like, I'm in excruciating pain. You can't do this. Like, everyone can tolerate it. It's just if they're a little more sensitive on their tissue, then I'll take my time. I don't really, it's hard for me to say. I don't time myself. I don't make it. I try to just focus on they're comfortable. We put the teeth in, we scan them, and then we talk about it.
And how long does the rest of the appointment generally take? I mean, I know that they're scheduled out for an hour. How often are you getting to that hour through all of the discussions and the getting to know them, the personal aspect as well? Like, is it round trip generally an hour?
It's like
Or
45 minutes
45
to an
minutes?
hour. Yeah.
That's about what I would expect.
But it's, as far as like the clinical side of it and like work, the majority of that appointment, don't get me in trouble, is talking.
No, that's what we hope for.
Talking with the patient.
That's 100% the reason why we designed it the way we did. That's what I always tell people. I brag, if you will, but I always tell people that the most positive part about this is what used to be the dentist or restorative assistant's job was to work as hard as you could for the whole time that you were there. You were grinding and polishing and rinsing off and trying in again and re-screwing in and re-gluing. And that took away from the experience from the patient, but it also took away from you getting to know the patient at all.
Yeah.
I want us to know the patient to the level that they want to know us. Like, I want that to be the case. If it could be 3 minutes of actual work and 50 minutes of talking, that would be even better. Because that helps the patient's experience. It helps you understand what they're looking for. It helps you hear their teeth more.
Yes. Yep. 100%.
Yeah.
Yeah.
I would imagine, though, that day one, because they're already uncomfortable, they've been through a lot already, I would imagine day one is almost the shortest of all the prototype visits, even though they're getting better and more accurate as you go through. Is that maybe a fair thing? Because I would imagine they're getting more comfortable, they're getting more excitable, they're having more feedback.
I'd agree. Yeah.
So they do lengthen in time.
Yeah.
Over
They do.
as
They
you
do.
get to know them. And when it comes to by the time you get to the zirconia, let's say that I had surgery last week, if I'm coming in for the zirconia, is that sort of, I always tell people, I want to make sure that I'm telling people the right thing in the consult. It's like the pattern of sort of wearing an old shoe where the first day it's a little uncomfortable, but by the last set that it will be like wearing an old shoe where it becomes comfortable, being the gum tissue seating. So my question is, when you get to the zirconia, are you still putting on topical? Is there still any need for that? Or like, what's their discomfort level on the delivery appointment day?
Lately, it's been, some patients will tell me not to use it. Again, it's
Is it pretty minimal by that time, or still like moderate to?
It's moderate.
Moderate?
I would say.
Okay.
Yeah. I've had a few tell me, no, I don't think it's necessary, or no, I think I'm okay. The installation is pretty straightforward, very similar to seating the PTIs. The only difference is we torque them in and close them up, and most times they feel better because it's zirconia, so it feels a little cooler going in versus a sticky print, not sticky, not sticky.
Yeah, well, comparatively, it's sticky.
A rough, print or what have you.
Comparatively, I'm always shocked at what the feedback is on a zirconia.
Yeah. It's crazy. A lot of them are like, it feels smaller and it feels lighter. That lighter is the one that gets me. It's like, how does this feel lighter? It's significantly heavier than the print, but they say it feels lighter.
It's always a decision that you have to make when you're talking about doing, in-person consultations, because do you leave the zirconias out and have them pick it up and go, oh my goodness, the internet was right. These things are heavy. Because we know in practice they will never, ever feel that difference, ever. Have you ever had anyone? I've had one person say that they felt heavy and they were annoying because they were heavier in all of my thousands and thousands of arches. Have you ever had any?
I've probably only had like one.
Yeah.